Okay, we're going to call this meeting to order, and first order of business is a motion to allow Betty and Rachel to be part of the phone call. Motion, please. Kate and Linda, okay. All those in favor? Aye. Any nays? Okay. Approval of the minutes of June 8th and July 21st. Can I have a motion on that? Phil? Are there any questions, comments, additions, deletions? No? Okay. All those in favor? Aye. Any nays?
Aye.
Okay. All right, moving on. We're informational items, and we will start with the Board of Health. Monica, welcome.
Speak directly into it, Monica. Yeah, what is it? Why don't you just come up to an empty seat where there is a microphone? Well, what?
Oh, better? Oh. So good afternoon. In your packet is our most recent Board of Health agenda and minutes. Wanted just to highlight a couple of things. We did, as many of you are aware of, we had already gone through a process in our most recent negotiations with our union on a merit-based criteria. That criteria was finalized and approved. We were able to complete some trainings as well and go through some just updates around that. I know we have further discussions on the Health and Human Service campus. And then as for COVID, a couple of updates we have. We're just over 48% of our county is fully vaccinated. We are now averaging about 50 cases a day in Peoria County, which is a huge jump from what we were at the end of May, where we're averaging about 1 case a day. Large majority of these cases are our under 30 population, so primarily children in elementary school as well as high school, and then our kind of early adults or 20 and 29-year-olds. They are having much more severe outcomes that we are seeing compared to, again, the other variants that we had last year in the fall. We are still working with the state on possible COVID services here to be located. I think that process is going to be pending just to get some logistics finalized, but more than happy to answer any questions.
Go ahead, Eden.
When you said 48% of the county, does that include people who can't get the vaccine, like those under 12?
So the data is for the full total population. So those would be including those that are currently uneligible due to their age restrictions. If we look at just our eligible population, we are over 50%, and some of our zip codes, when you look at that kind of nuance, are as high as 75 and over. But overall, we still do have zip codes that are just in the 30% of both fully vaccinated by total population and those that are even eligible.
Okay, any other questions? Linda?
I read the article in the paper this morning about the cell tower, and I guess my concern is that we would be putting up anything when we're looking at renovation or perhaps a new facility, and then have to build around something that already exists.
So great question. We actually started working with our cell phone tower vendor in 2017, 2018. They actually approached, I believe, County Administrator Sorrell about the health department property. Right off the bat, we were talking to them about the aspect that we may be doing major renovation to our facility, whether it's just renovation to the building or even additional spaces on that site. working with them, they gave us various options on the property that we have to see where it could be located. A lot of them would have been smack dab in places that we would build. So what the final plan that has been, that will be going through City Council tonight is actually at the very back of our property where it then slopes down. So from a building assessment, it wouldn't be able to be usable for the purpose of a large-scale build. Having said that, talking to our vendor, and they, again, we're fully aware of this, right now they still have to go through permitting processes, boring samples, a lot more steps before any construction is done. And they are aware that based on recommendations by this board, that if or when an approval of an architect and engineering firm as well as a construction manager at risk, the next step would be we would be linking the two together to make sure that any design work that was done by the cell phone tower company is addressed and understood by any architectural firm when they look at our campus as a possible location.
But I still am concerned about why we would be looking at a renovation or a new building, that why we couldn't postpone the location of the cell tower until we had every option and understood exactly what we're going to do there.
And I think that's a great conversation to have with the firms that get selected. My understanding from the cell phone tower is the earliest the build would ever happen would actually be Q1 of 2022. Realistically, they're expecting it to be Q2 of 2022. So hopefully we are able to have those conversations. And I think from the timeline submitted by both, by the architectural firm, a lot of that planning process happens in the first 8 to 10 weeks once the project takes off. And so hopefully we can have that dialogue earlier before construction happens.
Linda, anything additional? Okay, thank you. Steve?
I guess Linda's question spurred one additional thought, and it's probably already in our contract terms with the cell tower provider. If one of the options ends up being a decision by this committee and board to build somewhere else and transact this property to a new owner, make sure the contract terms are that if we as a county decide to sell that property, the transaction of the contract between the cell tower company and the new owner would be part of that.
So I can't speak to the details of the contract. I know it's been a while, but I think that would be something we definitely want to make sure that happens, or whether or not the county wants to own that, continue to own that parcel of land to be able to take the leasing cost from it as well.
Either way, ability to either parcel it out and own that long term, or to transact it to a future owner who would then be awarded, carry the contract with the cell tower provider.
Yes. Jennifer?
On that same note, going back to my time on the Board of Health, I believe that was in there because I remember our conversations about that if for some reason we weren't going to own that. So I don't have it in front of me, but I do recall having that conversation, and I believe that language is in there.
Great.
Right.
Any other additional questions?
Madam Chair, for everyone's benefit,
Yes.
so at the point undetermined in the future if and when the tower is to be built, the supervisor assessments office will actually create a new taxing parcel because that cell tower is subject to property taxes, and the owner of the tower, who's leasing ground from us today, will pay property taxes on that. So there will be a new tax ID issued, there will be a new parcel issued, and so should the decision of the county board be to relocate the health department to a different location, we would be able to sell the health department property and still hold on to ownership of the tower itself and continue to collect that lease revenue.
Okay, great. Thank you. Any other additional questions? Phil?
Matt, about the boosters that we're hearing about and so forth.
Sure. So there's been a lot of information about the boosters. Currently, the health department does do boosters for those that are immunocompromised. We have been working with our hospital system. So similar to how the outreach happened in January, our hospital systems are going through their own databases of patients and making sure that they are aware of their eligibility and getting them linked up to a booster. And we are also doing a similar practice with some of the clients that we serve, as well as we are testing, allowing people to self-identify. And we have been doing boosters now for about a week, and it has been going really well. The next phase of this is tentatively September 20th, when it opens up to individuals where their primary vaccine schedule would have been completed 8 months ago. So really looking at individuals in the healthcare community or long-term care facilities. Those were kind of that group that would be the first batch to come through. And so right now we are actually in planning phases again about this. It's a little bit of a different landscape. In January, as you guys might recall, we had total control of all the vaccine. We were giving it out to different entities. Now you can drive down the street and access it a plethora of locations. So we don't expect necessarily to have to do a large-scale booster clinic, but we are making sure that we just have our staffing available to take on additional individuals. We've seen already slight uptakes in vaccinations just based on yesterday's news, so we expect that to increase. And then gearing up for September and hopefully October when the age range drops, that would be another focus for getting vaccines to people that have not been vaccinated. So, I think the big question that's still out there is going to be our long-term care facilities. The state had awarded contracts to some of our large pharmacies to go in and do that service. Right now, they don't seem to be going that route for the boosters, so that might be something that we will have to partner with other entities to help with that vaccination process.
What do you see on the horizon for under 12 years old?
I will hopefully, the biggest thing right now is until a vaccine is available, and right now it does look like October is what we are getting, it's getting more and more kind of solidified, that time range. And the data is already there. I think the question that a lot of the pharmaceutical companies are having is they want to have more individuals in the data so that their risk, when they report out the risks, is at the same level as they did for adults. They know there's going to be a degree of difference because we don't recruit that many children into vaccine studies. But there's been a huge, my own kids wanted to be in the vaccine studies, so there's been a lot of interest in it. But I think what is going to be important is that leading up to when that decision happens in hopefully October to get under 12, and most likely be 5 to 12 is the range, to get vaccinated, that we have to do our best to get control of the virus now. Otherwise, you're going to be fighting uphill. The vaccine is going to be having to fight harder to get a hold in the community to actually do what it's meant to do, which is create that armor. So a lot of the process you see right now, masking in the schools, all of those are ways to try to get ahead of this so that when the vaccine is available, we're going to have a stronger foothold for it to start working faster.
Any other additional questions? Jennifer?
On the topic of the 5 to 11-year-olds, do you know what the transmission rate currently is in Peoria County for that younger group that is unvaccinated?
So, transmission rate is really about how a person that is ill shares it with another individual. I will say that, this time last year, that age range was making maybe approximately like 3% of our current cases. They're up to 8% now. But the Delta variant is highly transmissible. So to give kind of a way to visualize this, with the Alpha and the Beta variants that we had last fall and early winter, if an individual was sick, they would most likely get 2 to 3 other individuals ill. In the case of Delta, it is if an individual is sick, they're getting 7 people ill. So it's double the transmission rate. And so that's why it's a little bit more nerve-wracking this time around, because you have a highly transmissible variant that's spreading through. So again, all those mitigations we're doing is a great way to try to get ahead of it. The good news right now is that Delta is the most prevalent variant. So it's outworking, so to speak, other variants out there. Which is a good thing for us because we know what Delta looks like. We understand the makeup of it. So in that sense, it's good for us because it's always very nerve-wracking when you have a different variant that starts taking hold.
Okay, thank you. Any other questions? Okay, moving on. Do we have a report on Care and Treatment Board? Okay, we'll move on. EMA? Sorry, Monica.
See if this one works now.
Sorry.
I'm not as smart as the microphone over there. EMA, we are moving into September, which is National Preparedness Month. Jason Marks has been working at completing our after action report for our COVID response thus far. He has scheduled 2 meetings with community leadership, different department heads, so forth, to actually review the data that we have collected and identify key gaps that the EMA can work on addressing. So it is really much a work plan and a strategic plan about how the EMA needs to adapt training, different opportunities they need to bring in to, again, make us a much more resilient and responsive community. In addition, I know I brought up last time as well, he is working with county GIS to start getting a better visual of where all of our sirens are, our outdoor warning systems, just to make sure that as we kind of move into that transition season where the weathers are both hot and cold, where outdoor warnings become much more imperative, that they are operational, as well as that if there are any areas there are gaps, especially with vulnerable populations, that we have a siren that's operational and working in that area. So that is where we are right now with the EMA. In addition, he's also been pushing out a lot of PPE, especially to our schools, youth-size masks to help them start the year off right.
Any questions? Okay, moving on. Regional Office of Education, Beth, welcome.
Placing the Regional Office of Education in this committee I fit here. I mean, because following Monica is exactly kind of where we're at right now in your Peoria County schools. This is all we're talking about and doing right now. So all of your schools are in. They are in face-to-face instruction. As many of you know, Brimfield was one of our school districts here in Peoria County that originally passed their own back-to-school plan that did not adhere to the governor's mandated mask mandate. And after several exchanges with the Illinois State Board of Education, they voted last week to come in compliance with that mandate. So now all of your districts in Peoria County are using universal masking. So because of that, they're allowed different layers of mitigation and different layers of quarantine, which are already being utilized. So we have several positives, including at our school, already popping up out there, and we've been in school for a week. And Friday Night Lights kicks off this Friday, and I'm just nervous about what that could mean, but we will take it in stride. So many, there just are not enough thank yous to give to Monica and her team because they join our superintendent meeting, which this is serious. We were supposed to meet for about 3 or 4 weeks in a row in March of 2020, and we have now had that meeting every Monday except for a few since then. Is how we just keep coming back. We keep having questions. And so with Monica, it was like, okay, 3 feet, is that like hand to hand, or like how do we measure it? She's like, well, it's nose to nose, and what if they're sitting behind them in algebra? I mean, just think of all the questions. If you are a school administrator trying to keep your students safe, what does 3 feet mean? What if it's at lunch? What if it was 10 minutes? What if it was 12 minutes? What if and it's just so much. And so we kept her on the phone and her epidemiologist for about an hour this week, and then continued to talk. What would it mean to go remote? We will have to be in constant consultation with Monica and her staff because there is no remote education plan due to the governor's executive order expiring. So if numbers should grow as they did in Staunton, Illinois, if you're following that school district, the local health department in consultation with the school, it would be her authority that would allow them to go to remote learning, which is different than e-learning. Make sure you get that on the camera, the eye roll, that e-learning is for when a school district wants to use remote learning on an emergency day. Okay, so that's different. That's allowed. All right, so that's everything right now that's going on with COVID. We are continuing, there was volleyball last night, so we are continuing to move forward with usual activities with as much mitigation as we can possibly put in place and continuing to encourage the vaccinations for especially our high school students. Okay, so that's that piece. Other than that, we're back to school, and I love back to school, and August is the most exhausting time of the year. It's unreal. So I wanted to give you an update on Smart Alerts. To remind you what Smart Alerts is, that's the allocation that was approved to my budget for $15,000 to allow us to partner with Katie Johnson's organization that provides, if there is a significant event in a neighborhood by address, the school is notified. If there were shot spotter alerts, if there was an arrest in a home, domestic violence, the schools are receiving those alerts. And we're currently working on that with Peoria Public Schools, Illini Bluffs, Pleasant Hill, Pleasant Valley, and I think there's one more. But we're really working to get that off the ground and get that in a process so the school knows what to do when they receive that information. And it's not just a nice to know, they actually act upon that information. So that's our next step with those schools. And in conjunction with that, I helped co-write a grant and am part of, with Unity Point, that is bigger than Smart Alerts, to put mental health therapist. A school counselor is not the same as a mental health therapist, even though they have the word counselor in their title. So school counselors quite often are dealing with A to Z and D1 algebra first hour, and their schedules are overwhelmed. So this would be actually putting counselor therapists that can deliver actual therapy at the school. So I wrote that grant. We're really hoping that that will come through. Okay, last but not least, I wanted to end on a real positive note, 2 huge ones. This one might make me cry. We served hot lunch today at Peoria Regional Learning Center. It has been 10 years and we got it done. I am so grateful to Dr. George McKenna. We had a strategic planning meeting this summer, and that was like #1. And I could go on and on about what we tried to do to provide food out there, but we could just never get it done. And this is one of the small gifts of COVID. With everybody being eligible, we were able to get it done. We got a warmer, like the whole thing. I am just, you have no idea how happy that makes me. And then I hosted our strategic back to school meeting, which was why my office was closed. And I just want to let everyone in this room know that even though George's team won the Office Olympics, he cheated. So if you see him in the rubber band shoot at targets, he's 6'4", and he leaned in that far from the target. So the other team was in gold, and he took the first place. And so if you see him, you just let him know that you know that. Okay, so that was the Office Olympics of the Regional Office of Education. So I wanted to end on a positive. So anything, any questions?
Any questions?
Have?
Yeah, Jennifer?
In terms of the grant for the mental health therapist, what is the timeline on that that you're looking at?
Oh my goodness. I was kind of more of the support. Unity Point took the lead, and so I'm not 100% sure, but as soon as we know that, I will certainly let you know, because that's bigger. We actually pulled in our high school, Peoria Regional, into that. We pulled Princeville into that. So Smart Alerts are not. It's actually bigger than that we're looking to place those. And then we'll have other hurdles to overcome. The idea of, we don't want Steve come to the office in the middle of third hour and everybody knows where he's going. So, you know, we have to work through processes and procedures, and all of that will come after that. We want to be very cognizant so that people will be willing to utilize the service. I don't know about staff. I don't remember if that part was written into the grant or not, but definitely our students.
Phil?
Yes, how are the schools supposed to handle the fans coming in to competition inside the building?
Well, Phil, I was at Meet the Lions last Friday, and let's just say everyone came to Meet the Lions, and it was packed. And so I'm a little nervous about that, but right now, do we have restrictions?
Did they do anything in
Don't.
volleyball last night? Because I know there were
No.
volleyball games.
No, they did not. So at this time, there are not those restrictions.
So you had recently a push for attendance. How did that go? Do you feel it was successful?
That seems like such a long time ago. So we used some grant money that we got from COVID to launch our massive campaign on getting back to school. We helped sponsor T-shirts in Peoria Public Schools where they went door to door. If you followed some of that on social media, you saw those teachers in the bright yellow T-shirts knocking on doors. My staff, we also bought some books, and they went door to door and delivered books and tried to get kids excited about coming back to school. The number I'm waiting for, and I'll report back to you, is the September enrollment number, and I will bring that to you so that you know. But we had that all over the place, including Sean Livingston got us a video there to launch at the last minute, and it was a push everywhere. So I'm hoping that September enrollment number will see some movement on that needle. But I hope that, thank you very much to you and other county board members that were there for that press conference. You heard, I mean, Dr. Crott in that press conference, she was looking for 400 kindergartners that hadn't registered yet. So the need is great, for sure.
Thank you for everything you're doing. So Jennifer?
I have another question. It might be kind of a you and Monica question. So I have a school in my district that does not have air conditioning. I'm assuming on a day like today, a lot of fans are going, windows are open. I have heard from parents that are concerned about fans. How concerned, and with Phil, when you mentioned a different type of fans, it sparked the thought. How concerned should these parents be about the use of fans in the classroom in terms of COVID?
I will let Monica answer the fan question, but I will tell you this. With the ESSER $3 that are coming, which were significant for many of our districts, most of them are using it for upgrades to facilities, specifically with HVAC and air condition type things. Anything about fans?
So in regards to COVID, and that it's actually a best practice to actually have airflow as much as possible, partly because as you have airflow, you have less likely of settling of particulates or droplets. And so a lot of the best practices, I mean, even in our dental clinic, for example, is we keep our windows open and we keep fans moving because air circulation is going to be the best. So if you don't have an upgraded HVAC system, that's going to be your best option for safety reasons too.
And I do want to say that triggered my thought, Jennifer, that if there is an outbreak in a classroom and the classroom there is a provision in school code that allows for remote learning for anyone that is medically compromised and has to learn from home or that is on quarantine. So we are providing remote, it's happening now. We already have students in quarantine that need to receive at-home learning.
Okay, thank you both. Anything additional? Okay, moving on. Sustainability. Becca, welcome.
Good afternoon. I only have a few highlights from the agenda brief that you received in your packet. Household hazardous waste collection event, as a reminder, is September 18th. So online registration has been open for about 2 weeks on that, a week and a half. And phone call-in registration will start on the 30th of August. We don't generally get a lot of people that need to call, but some people do appreciate that opportunity to be able to call to make their appointment. And again, the appointments are really just traffic management. We have 1,080 appointments open, not open, but the total event has 1,080 appointments, so quite a few. In 2019, we had 800 cars, so we're hoping to be close to that. Again, McLean County and Springfield, or Sangamon County, have one this year as well, so within close time frame. Both of theirs are in October. We haven't had that in all of the time that I've been in the sustainability department, had 3 events so close together. So that's a little bit different. The CPACE launch webinar for Peoria County is this Thursday, the 26th. I think all of you received an email on that. We do have 40 people registered for that so far. And then one last push today to try to get a few more people registered. So if you know of anyone who might be interested in learning about that, the registration is still open and active on our website. And it will be posted on the web. The video will be taken and it will be posted on the site afterwards too, for others to learn a little bit more about property assessed clean energy. And I think that's what I have, unless there are questions.
Any questions? Yeah, Kate.
Can you just talk about what is and what isn't accepted at the household hazardous waste event?
Yes, most importantly, latex paint is not accepted. Latex paint has very low toxicity, mostly water-based or is water-based, so that can be dried out. This is for household chemicals that you may have, like yard chemicals that weren't used, drain cleaner, things that you know that you're not going to use or did not use in totality, that you can bring. People call sometimes with they're cleaning out a parent's house and there's just a jar that says use gloves. I had a retired high school teacher call and said that they had taken their mercury home with them, so they had a jar of mercury. So that's absolutely something that should come. A number of other materials that are accepted, like batteries, fluorescent tubes, oil, waste fuels. There are outlets for those year-round in the county, and hopefully people have been using those. So that's also the education piece that goes along with this, but those items will be accepted too. So kind of a one-stop shop.
Any other questions? Is there a landfill update?
I was not at the last meeting, and I looked at the agenda, but I haven't seen any notes. The next meeting is the 15th. The tipping fees are back in line with what they have been in the past. There was a dip in the spring, but they seem to be right back in line with previous years.
Right. Any other questions? Okay, moving on. Thank you, Becca. We are at resolutions. Our first one is award of architect and engineering services for Health and Human Service Campus. And Scott is going to have a presentation for us.
I'm sure if you want to get the first one on the floor.
Oh, yes, sorry.
No, that's quite all right.
Motion, Eden, and a second from Kate. Okay.
Right. So one slide deck that'll cover both resolutions for you today, Madam Chair. So just first couple of slides are just a little bit of review of where we're at in the process. I told you every time we talk about this project, we'll have this slide before you. And for those of you that want to follow along on your iPads, if you refresh your iPad, this should be in the Health Committee folder on your iPads in Goodreader. So today's two resolutions are the next action point for the board and this committee, and that is the selection of the design team and the construction manager at risk. There are a whole host of other decisions that you'll have to make before we get to deciding whether or not we're going to build a new building or renovate the existing building. If we decide to build a new building, is it going to be at this location or not? And then actually awarding contracts for the various construction divisions when we get to either remodeling or the current building or building a new one. So a whole host of policy decisions for you to make in the next several months. If you recall, we've broken it up into a pre-phase and then 5 phases, so a total of 6 steps. We're at the end of phase 1, where we're selecting the design team and the construction team. If just as a quick refresh, the pre-phase is complete, and that's where you appropriated monies for the 2 resolutions before you today in this year's health department budget. That was your previous action item as a board, as a policymaking body. And then we've now moved in, and next time we meet, this phase one will be marked as complete in its status as well. So your decision points in phase one were to select the project delivery method, to provide feedback and the desired scope of work items for the RFQ that we solicited proposals from for both resolutions today. And then the third policy decision is the two resolutions that are before you today. A little bit of detail in terms of the design team procurement process. We actually showed this slide last time as well. So the peach colored circle was your decision on the project delivery method. Then what we did is we went through the process of procuring architectural and engineering services and construction management at risk services with the integrated project delivery method tacked on top of that. How we went about that, we'll get into the next couple of slides that got us to the two recommendations that we have before you today. First, architectural and engineering services. A couple of key facts. For both A&E services and CM services, there's a grand total of $500,000 appropriated in Monica's budget for this year. So that bullet point is consistent. You'll see it on a future slide as well. Same thing with the qualified-based selection methodology. That's something that's allowed for in state law in terms of how we select. And what that means is we pick the best firm, in this case, versus an individual, for our project based on a variety of criteria that we're allowed to use and judge those submittals on. We will not discuss fees until actually you've awarded the contract for architectural and engineering services and construction management services, at which point we will sit down and negotiate the actual terms and conditions of a contractual relationship, including fees. In the state of Illinois, architects specifically could put their licensure at risk if they actually are responding to a request like this and quoting us a price for their services when using the qualified-based selection method, which is what we used. So specific to architects and engineers, we had over 25 firms that we specifically invited to submit a statement of qualifications. We also posted our request for qualifications in multiple plan rooms, and so the number of firms that actually saw it is significantly larger than that. But I don't have an exact number because if they don't register and download materials, but maybe just looked at it, we wouldn't know that. We'd only know those that actually downloaded materials. But of those that looked at materials, we had 5 firms submit statements of qualifications. A review of their materials found that they were complete applications or complete statements of qualification, so they were capable of being scored. In other words, we didn't kick anybody out at that step because it was an incomplete package of materials. So everybody was deemed to be capable of being going through the scoring system with the internal review team. So your internal review team, which consisted of Dr. Armour, who's the current president of the Board of Health, Monica's finance director, Brian Gully, Mark Little, who's the CIO and also has facilities under his responsibility, and myself is your internal review team. We scored all 5 of those statements of qualifications against our criteria, and our criteria were weighted, and I'll show you in the next slide what those criteria were. And then we shortlisted those 5 down to 3 that we then brought back for interviews that we had last week. And the RFQ was written in such a way that we did not have to shortlist. We could have brought all 5 into interview, but there was actually a pretty natural break between the top 3 and the bottom 2. And so we, as a group, chose to shortlist to 3 and then bring those in. And then after the interview process was completed, after we did reference checks, we rescored and then made a decision on the most qualified firm. The recommendation before you is unanimous amongst your internal review team. So just looking at the three that were shortlisted, we shortlisted Farnsworth Group from Peoria, Kluber Architects, who are headquartered in Batavia, Illinois, but have an office in Bloomington Normal, and Dewberry Associates, which have a significant presence here in Peoria as well. The criteria that we judged all 5 on the original scoring and then rescored after the interview process was the firm's size and experience as it relates to our project or similar projects, the design team's composition and just their general experience, their project and approach and methodology for how they were going to really be partners with the county and whoever the construction management firm is going to be in this project. The financial capabilities of the firm. Do they have the size of the firm financially, and are they capable of taking on a project of this size and scope? Their references, and then after the interview process, we added a final category about knowledge that we gained from the interview process. They all had different varieties of weights, and so the maximum possible score that any one firm could get is 8.0. Farnsworth is the recommended vendor. They received 7.01, and you can see Dewberry and Kluber were very close together, and if I actually took it out a couple more decimal places, it would actually be even closer than what you see here. Some of the reasons why we selected Farnsworth, or we recommended Farnsworth, based on the material submitted in the interview, they have what we felt was the best team that they had assembled for this project for us in terms of their experience and the firm's experience in terms of project approach and methodology. We believe strongly that their approach and how they want to engage with the county as owner, and that's not just the staff, but that's you, how they want to engage with the various stakeholders that will be necessary for the success of this project was the best approach for what we were looking for, most closely aligned with what we were looking for. And then in terms of references, not to say that any of the other 2 references were inappropriate, because that's not true. They were all very equal. You can actually see that Kluber and Dewberry rated essentially 1 point on the rating scale, and then we apply the weighting factor to it. Actually had a little bit better references, but overall we felt Dewberry is the most qualified to deliver services. Oh my God, Farnsworth is going to kill me. Farnsworth Group is the best and most qualified to deliver the services. So, Madam Chair, I do have slides about construction management services and also next steps that I'm happy to walk through now, or if you want to wait until we get through this item and then on to the next item, I can do that. It's whatever yours and the committee's preference is. Okay, sounds good.
Okay. Any questions? Any questions? Linda?
Well, first of all, I would say that I think the choices are excellent, and I worked with exactly these 2 firms for 3 years in building the Peoria Public Libraries. I am curious to know about the negotiation of fees. I understand this system pretty well, and my issue is that when it's a public project, there seems to be an expectation that the percentage of fee paid is higher than what you might do, let's say, at your own home. So I would certainly ask that we have somebody who's very familiar with this kind of negotiation do those negotiations to tighten up those fees and not make an assumption that because it's a public project, they're going to get, let's say, 11% or whatever the percent is.
Great point, Ms. Daly. I think, and speaking with the experience that that we've had with the museum and the nursing home, and the county board at that time over a decade ago having the very same, if not identical, sentiment that you've just raised. You've got a team in place right now that is acutely aware of that issue and will absolutely be taking those comments into account when we negotiate fees for both of these contracts.
Okay, thank you.
Any additional questions? Kate?
One of the things that I'm interested in knowing how they're going to go about this is the bullet point here on the agenda briefing about mandated versus discretionary service process mapping and service delivery mapping. Because we're talking about public health, and then this is an architectural firm, how is an architectural firm going to do some of this public health analysis? Are they going to use public health experts?
Great question, Kate. Farnsworth is a multidisciplinary firm, not exclusive just to architecture. They have planners, they have engineers, they have architects, and a whole bunch of other consulting services. And their teams also have healthcare experience, and so we feel highly confident that the Farnsworth team is going to be able to do that type of analysis for us once we get into this project.
Any follow-up, Kate? Okay. Any additional questions? Okay, we'll take a vote. All those in favor? Aye.
Aye.
Any nays?
Aye. Aye.
Okay, any nays? Okay, that was unanimous. Moving on, next resolution is award of construction manager at risk for Health and Human Service Campus. Can I have a motion, please? Jennifer and Phil. Okay,
Right.
go ahead.
Thanks, Madam Chair. The first 6 slides of the slide deck apply to this conversation as well, so I'm just going to go straight to the key facts page for the CM at risk. And the first two bullet points of the key facts are actually identical as well to the previous resolution. In this case, in terms of data points or number of firms, there were 15 known construction manager firms that we invited to submit statements of qualifications, and again, we posted the RFQ to multiple plan rooms where a much larger group could review those materials and make their own business decision as to whether or not they were going to respond. We did have 3 firms submit their statements of qualifications. All 3 of them, initial review was deemed to be full and complete, so that means, again, they were able to be scored. We didn't remove any of them from the process at that point. With only 3 submittals, the internal review team made a decision that we were going to shortlist all 3 going into the scoring unless one of them was so far out of whack with the other 2 that we would maybe shortlist it down to 2. But when we went through the initial scoring process, we saw that bringing all 3 in for the interview presentation process was a valid exercise. So we did those interviews and presentations last week, and then just like the architecture and engineering services, we did that rescoring, checked the references, and determined who the most qualified firm we would recommend to you. And again, the recommendation is unanimous by your internal review team. So those 3 that we have are River City Construction of East Peoria, PJ Hare of Peoria, and Point Core Construction of Peoria. So all local firms within the region. We are recommending River City Construction Again, the maximum point total is 8.0, and so you can see River City had a total of 6.79 out of that 8, and then the spread between all three of them is pretty close to being equal in terms of whether or not they were close to one another or not. You can see for us, and looking at why we chose River City, their firm size and experience matched and aligned well with what we are looking for, as is the team that they have assembled for this project. All three of them had very equal approaches and methodologies. The financial capabilities, River City and Point Core, you can see rated a little bit higher than PJ, and that's just because they're larger firms and have larger capacities. PJ's size, they are capable of doing our project, but when in relationship to the other two, they aren't as big a firm. References, River City's references had the highest rating, and then knowledge gained from the interview process. You can actually you can see PJ actually rated the highest. They brought and proposed some good approaches to how we would comply with our goals that we talked about early on in this committee about minority and women and disadvantaged and veteran participation on the project. River City had also put in their materials what their approach was going to be, and we thought that their approach is very sound as well. At the end of the day, River City is the best fit for us for this project, and that is our recommendation. Madam Chair, I'm happy to then do kind of the next steps slides if you want me to, or if you want to do that under miscellaneous once you've had the vote, I'm happy to do that too, whatever is your pleasure. Okay. So phase 2, which we've not started yet, we'll start that once we get approval from the county board, assuming today's recommendations are endorsed by you, and then the county board endorses and approves your recommendation to them. There are 5 different policy actions that will be your responsibility in the next phase of our project, and the first is having multiple gate checking events or meetings with the design team and with your team to report out various findings.
Brian Elsesser joined.
And then you'll also be at some point in the future, and I've got a graphic to kind of show this here in a moment. You'll be making a recommendation to the board on the renovation versus replacement decision, and if going down the replacement road location. We'll also need to, you'll be determining how this project integrates into our strategic planning outcomes that we're going through right now. Fourth, with the Finance, Audit, and Legislative Affairs Committee discussing the funding options based on the preliminary budget from the design team. That'll be towards the end of this phase. And then actually seeing the county board vote on that renovation versus replacement, and if necessary, the site decision resolutions. And those will actually be towards the end of this phase. So graphically, how does that look? So there won't be really anything for the civil engineering component of the A&E services to do at this point in time. There will be little for the construction manager to do at this time. Most of it in this phase is going to be between the management team and the architect. And the first is going to be that mandated or discretionary service delivery component. So we're going to collect data and provide that to them. They're going to analyze and report, and then we'll report that out to you. It's not enough to define what the mandated and discretionary services are, though. The probably the more pertinent question is, at what level are those services being delivered? So that's the next step. So we'll have a back and forth and a lot of interactions with the architectural and design team about that. Again, we'll have another report out meeting about that so that you know exactly where we're at. And then discussion will then influence each step going forward. Third, we're going to be providing as we look at how we build the service delivery model and the building in terms of renovation versus replacement, client demographics and geographic data for not just the health department, but the other county departments that are potentially part of this conversation and could be part of the campus should we, depending on what your decision might be. Again, there's analysis and a report out from the design team, and then feedback loop for this committee. And then we'll take all that information, we'll work on the renovation versus replacement analysis, and provide a recommendation to you on whether or not we should renovate or replace at the end of this phase. And then we will, should you choose to replace, then we'll also have that policy discussion about location. And so this phase is going to take several weeks. We'll integrate into this conversation the cell tower topic, as that is a potential feature on the property, the current property, that could have an impact on these discussions and the analysis. So we'll work that into the analysis component, and at each step of the way, you'll have an opportunity for feedback and to provide guidance back to us to ensure that we're going in the right direction, but if not, to redirect us. Happy to answer questions, Madam Chair.
Okay, any questions? We'll start with Eden.
You use the same internal review team on the construction management, right?
That's correct, yes.
And were all three of these groups comfortable with construction management at risk? Had they done that before?
Yes, all three of the respondents had noted in their statements of qualifications work using that delivery model, yes.
Okay, Kate?
One of the things that I'm really interested in making sure happens with a new building or a remodel is to consider whatever is done having an effect on our operational costs of a building. I know that Headington Oaks was built LEED certified, but from what I saw, that building was a high energy user, and maybe that's because it was a 24-hour facility, but regardless, it ended up consuming a lot of utilities, and therefore being pretty expensive to run that facility. So in looking, and I'm not sure where this fits into the conversation at this point or a later stage, but I just want to make sure that whatever we're doing, we're making not just, LEED type decisions about where we're building, but having a thought for the future for how those operational costs are going to be affected, and, using skylighting instead of lights, using LEDs instead of a cheaper type of lighting fixture, consider electrification, eliminate the need for any natural gas needing to be in the building. Things that are current trends for going towards more sustainable building type things. So anyway, I just wanted to mention that as far as, there's building LEED, but I think to also keep an eye on, what are the costs of running all this, this entire building going to be.
Okay, Linda?
To add to what Kate has said, I'd like to request that. I know there is, so I read in the minutes, an unwritten policy that any building we build will be built at least to silver certification LEED. I would like to have an opportunity for the committee to have a discussion about that and not just assume that that unwritten policy is what we're going to do in part because of things Kate has brought to everyone's attention, but I think this is a bigger conversation, and I don't want to go forward without having it.
Okay. I also want to add that next month on our agenda is going to be a discussion on owner's rep, which you've brought up, Linda. So we're going to be discussing that, as well as Monica's going to start preparing data for us that we can look at. So we're going to start digging into the data of, who's using our facility, who could potentially be using our facility, where these folks are coming from. Are they driving? Are they, taking the bus? Are they walking? So I think we're going to start digging into the data. So we'll be looking at those two things as discussion items next month. Okay. Kate?
Thank you.
Is that, so you, thank you for that. I'm glad we're going to be talking about that more in detail. The other thing that I'm interested in is also kind of the reverse. And so we're talking about people coming to the facility. Can we also look at opportunities for where it might be smarter to have us come to them, either satellite or, what am I trying to say? Mobile, things like that.
Okay.
That's something that I'm hoping that we can add to the conversation as well.
Okay, great. Any other questions or comments? Okay, we're going to take the vote. All those in favor? Aye. Any nays? Okay, that's unanimous. We are at miscellaneous. Any miscellaneous? Okay, then we're adjourned.
running a few minutes late. First on the agenda, I'd like a motion and a second to let Brian Elsasser call in.
So move.
Okay, Phil, a second. Sharon, thank you. All in favor, say aye. Aye. Opposed, same side. Motion carried unanimously. Next, we have the approval of the minutes. Can I have a motion to approve the minutes? Eden, thank you. A second. Sharon, are there any additions or corrections to the minutes? Okay, all in favor say aye. Aye.
Aye.
Opposed, same sign. Motion carried unanimously. Okay, moving on to informational items, reports. We got the ETSB. Jody, will you do that for us? Thank you.
Good afternoon, everyone. Jody from the ETSB. Just filling in for David today. He's officially retired and now he's on vacation. So we really don't have a whole lot going on right now. Things have kind of settled down with the new construction at both of the telecommunicator centers. So we're kind of working on a new project. So just in the beginning stages of that.
Any questions for Jody? So everything's still going smooth with the remodel at both places then?
Yes.
Everybody's happy?
Everybody's happy. It's
That's good.
going really well. If anybody missed it and wanted to go visit, you're welcome to come down at any time.
Okay. Any questions for her yet? Okay, we'll move on. Thank you. Nate with the Public Defender report.
Good afternoon, everyone. I don't have anything to add to my report, but I'm happy to answer any questions anyone might have.
Questions for Nate? Did we get all the questions answered from the last couple of meetings that we had? Or a couple, 3 or 4, maybe that was 6 months ago, I don't know. No questions for Nate today?
Very good.
Okay.
Thank you.
Nate. Okay, and then all right, my pad just went down. Here we go. It's the transfer, no, excuse me, FY 2020 Edward Byrne Memorial Justice Assistant Grant, the JAG grant. Sheriff, would you like to take that one for? Oh, Randy?
I've been
Randy.
delegated to handle this. This is just an informational item. We partner every year with the city. They're the lead agency that applies for the JAG grant. So our share of the FY 2020 JAG grant, we're going to use, it's $24,628. We're going to use that to buy some vests and some in-car radar equipment.
Okay, any questions for Andy on that? So always great that we've got the money to do the important things.
Every
like
little
that.
bit helps.
Every little bit helps. All right, we'll move on to resolutions. The first one's the Adult Redeploy Grant, SFY 22. Can I have a motion to put on the table and a second? Okay, Eden and Brandy, first and second. Okay, Mark Bronke, thank you.
Good afternoon, everyone. This is a state fiscal year 22 continuation grant through the Illinois Criminal Justice Information Authority. We have been the recipient of this grant since 2013 and have again for state fiscal year 22 been awarded $226,000 to continue our adult redeploy program. This program funds 2 of my full-time redeploy officers and then half of a supervisor. That is including salary and benefits for that staff, as well as all the program expenses related to that program, being electronic monitoring or any drug testing, any of our surveillance equipment that we use for that population. Be happy to answer any questions regarding that. Typically we serve around 90 a year, a little bit lower this year with the pandemic hitting. It kind of slowed us down as far as our numbers, but typically 90 adult redeploy offenders are served annually.
Okay, thank you. Any questions for Mark? Okay, thank you.
Thank you all.
Next we got to vote on. Okay, thank you. I knew I'd forget something. Okay, all in favor of Yes, we got Eden and Brandy did the first. I did get that part. I just forgot to vote on. All in favor, say aye.
Aye.
All opposed, same sign. Motion carried unanimously. Thank you. Next resolution is FY21 appropriation related to FFY20 State Court Improvement Program Grant. Jennifer, you're going to take care of that and bring us up to date on what's going on with it.
You need a motion?
Oh, thank you. Motion put on the floor. Sharon, a second. Brandy, thank you. Thank you.
Okay. We were given the opportunity to apply for some COVID funding through the Administrative Office of Illinois Courts that just needed to be spent to facilitate remote hearings in the juvenile abuse and neglect courtroom. We chose to use that to set up the Juvenile Detention Center as a remote court hearing site. And to do that, we needed to purchase metal detectors. When we were awarded these funds, they decided to amend a current grant that we had related to juvenile abuse and neglect court. So what I have before you is to amend a current grant report or grant agreement we have. I just learned this morning that they have changed their mind and instead want to write a new grant for the same amount of money, but not award it for the purchase of this equipment. The grants that they give out in this area are not usually spent on equipment, so they decided it'd be better off for us not to use grant funding anyway. This way the ownership of the equipment will be with us. There won't be any federal monies involved. So their solution was that we would just pay for that equipment outright, and they would instead give us a new grant agreement in the same amount that we could put towards attorney expenses we have in that courtroom that we're already obligated to pay. And then in talking with Mark further, we decided to purchase the equipment using the probation service funds, of which we have a healthy fund balance. So the money will not be spent out of JDC's budget or the general fund, out of the court's budget. So essentially, by the time this goes to the county board, the resolution will be changed just to ask for approval to enter into a new grant agreement for the $21,000 for attorney expenses in the juvenile abuse and neglect courtroom.
Okay, do we have any questions for Jennifer?
Jennifer, are you, do you have the new grant for our office to review yet?
I don't, because I just learned about it this morning. She thought she'd be able to get it to me by the end of today or tomorrow.
We could just table it and do a poll vote if you want before county board. I'm just thinking we don't really know.
Right, and depending on the how the resolution is worded, you know, it's authorized and directed to execute with the approval of the state's attorney's office. So if you're not able to review the grant agreement prior to the county board meeting, at least the approval is there once you've been able to sign off on it. So
this current resolution already has the agreement approved because I was able to look at the amendment. So that's why we would have to change the resolution here, the wording of,
right.
of
So
this one to vote on
I think
it.
maybe if it's, Mr. Chairman, if it's the consensus of your committee, if you all understand the issue and if you're all supportive of it, I think what we would do is we would draft a substitute resolution that we would then poll vote, and that would be what actually goes to the county board on the 9th. Obviously, if you want, there's more discussion necessary, then maybe it's easier to defer for a month, then we can do that as well.
Questions for?
This grant for the juvenile abuse and neglect courtroom, we've been getting for several years, yes. Thank you.
Nope, I'll do it again. Sorry about that. The next resolution is a transfer of funds from County Sheriff to Sheriff Merit Commission for FY 2021. Can I have a motion to put that on the floor? Eden, a second. Sharon, thank you. Sheriff, proceed.
Thanks, Mr. Chairman. What we're asking here is basically we're running short in our Merit Commission funding for the remainder of the year, and we were looking for a $7,000 transfer internally from our 0112 line item. The main reason for this is just the increase of testing applicants. Their primary responsibility is the Merit Commission is for commission personnel doing the interviews. So this covers their per diem, some testing materials.
And with the job market the way it is, you're probably doing more applicants than what you normally would do. Am I assumed to safely say that?
I wish we could be doing more.
Yeah.
Yeah. We're running every person through. Beforehand, there was kind of a line of demarcation where you would just funnel several through at a time depending on the need. But since there's such a vast vacancy right now, pretty much everyone that makes it this far in the testing will go through the Merit Commission process.
Okay. And this is money that you've already got budgeted in yours that it
Yeah,
won't
we're not asking anything from
any
a
extra
general
money.
fund transfer. This is an internal transfer from our 012 line item over to the Merit Commission.
All righty. Anybody got any questions for the sheriff? Okay, all in favor say aye. Aye. Opposed, same sign. Motion carried unanimously. Okay, sorry, my iPad keeps going. I guess we're up to committee action, review of executive session minutes. I'll give it to you, Jenny.
It's the recommendation of the state's attorney's office that all previously held minutes continue to be held because the need for confidentiality still exists, and to destroy executive session audio recordings that are more than 2 years old, except for those that relate to pending litigation.